keratoconus and presbyopia. The keratoconus had the classification of Ambler is the first stage of keratoconus is the best case scenario of the patients. This type of patients, they have this kind of patterns. These patients have good ocular surface, good best current visual acuity, biomechanics, findings, and good tachymetry. If this patient has cataract, generally this type of patient doesn't have breathing problems due to myopia or myopic astigmatism. Usually, they are younger patients. If this patient has cataract, you choose spheric iris or toric iris. If the patient has high HEOs, you go barometry shows big high aberrations, you can choose this kind of segment, intracorneal segments. Never use 5 millimeters of this segment. You choose 6 or 7 millimeters. These patients, another male patient was referred from our institution with visual acuity decrease and others in his left eye 6 months after cataract surgery. This patient has 20/20, and this patient is 0.8. Then reduce the visual acuity to 0.4 and referring to me to insert an intercorneal lens. The problem was that it's not in iris was not centered. It's only the problem. The change the iris for monofocal types is not a problem for ectasia. It was a decentration. In conclusion, small asymmetries sometimes do not cause subjective visual disturbance. Usually, do need any surgical intervention. If you need to use iris formulas, have good predictability. The second stage is the most frequent scenario. This type of patterns to define central cones and paracentral cones. These are predominant spherical myopia, predominant cylindrical types. These patients, if have cataract, spherical and orthotic iris, and correct corneal asymmetry at one, if they have high HOAs with intercorneal rings. In this type, you have used symmetrical intercorneal rings like Ferrara, or use this type of rings. The other side, in paracentral cones, they have predominant cylindrical and bigger IOAs and asymmetrical approach they need. This type of approach they need. They type Eintax and they type Ferrara rings. IO formula usually has good appearance, worse is paracentral types. Patients, 60 years male, contact lens user, is the first correct asymmetry of the cornea. There is pre and post-op. In the second surgery, we make a cataract. After 6 months and stable reflections, we use a SRK2 formula. The yours chose for the was plus 0.55. 4 months of the surgery was plus 3. Analysis the case, we recalculate the iron with another formula with Haggis plus 4, over Q plus 3. All formulas in this case would result with a reservoir and method. In conclusion, if the cornea is too asymmetric, try to correct with intracorneal rings. Try to use first or fourth generation formulas. Presbyopic metropy can be correct with a secondary lens implant. In the third stage of Ambler is the most frequent scenario. These patients, they have this type or patterns. They have bad ocular surface, low visual acuity, and high myopia and astigmatism. These patients, they have a suspension of use of contact lens to avoid warpage, improve ocular surface, treating inflammatory components. Intercorneal rings to reduce HOAs, intercorneal rings plus spheric sclerosis, or spheric sclerosis plus scleral lens. We have. In this type of patients, caption should be taken with spherical cornea with low acuity. Always use intercorneal rings with little effect. These patients, they have this type of patients when you put Ferrari rings, it's a bigger astigmatism was created. Index don't create this high astigmatism. In this type of patients, the IOS formulas is less accurate. These challenging biometries, anterior and posterior corneal radial alterations, apex usually displaced, ocular surface alterations, greater anterior camera lid, and keratometry values and IOS formulas is a challenge. SRPT is the most used formula, but new formulas could have better results, but more reports are needed. Another option is leaving the patients aphakic when used post of refraction to choose the right eyelids. This type of patients is the worst case scenario. This type need a corneal transplant. In conclusion, keratoconus, they have 4 stages. It's very different to treat different stages. In the first stage, small symmetries sometimes do not cause subjective and visual disorders. In 2, if cornea is too asymmetric, try to correct with intercorneal rings. And the most frequent scenarios, corneal asymmetry should be correct with intercorneal rings. Thin cornea should be treated with index. And 4th, a PICA is necessary. Any formulas have good predictability. In stage 2, try to use first and 4 generations. Residual ametropy can be corrected with a secondary lens implant. In the first stage, new formula, Oliver or Olsen, may have better results. Another option is leaving the patient's fatigues, then use post-op refraction to choose the right eyelids. Thank you for your attention.